Namaste. I welcome you all to this session number 19 of Gurubodha with Dr. M.B. Gururaja sir. Dr. M.B. Gururaja sir is an Ayurveda professor and a very busy Ayurveda practitioner. He practices at Development Care Ayurveda Treatment Center, Shivamoga, Karnataka. For consulting for health complaints or to get his guidance on case-to-case basis, please visit easyayurveda.com/Guru Raja. In the last class, we were discussing regarding the patient referral. So we learned from Dr. Gururaja sir that it's not a matter of shame. We have to refer patients at the right time to the right center. Because sometimes it's a matter of life and death. So how to tell to the patient or what to tell the patient and what are the words to use while counseling the patient that you are being referred to a higher center and you have so and so illnesses, some more investigations are required. Because if you mess up in the language, then the patient will be confused and patient may think that either the doctor is like incompetent. So how to handle this situation with words?
There are two important aspects we need to understand: when to refer and how to refer. Whenever we feel that the patient is in such a grave condition that he cannot be managed at my center, then he has to be referred to the higher center. That is the first criteria. Second thing, there are certain times when a patient comes to us and we feel that this is a condition which is better managed by one of my friend or my senior or my teacher or my guru. He is dealing this type of patient since many a times and he has a better exposure to these type of diseases. Let him handle and let me send this patient to a right kind of person. So with these intentions, we can send the patient, refer the patient. While referring the patient, what it should be conveyed to the patient and patient relatives. This is very important. So while referring the patient, if the condition is serious or which requires an institutional care or some higher center care, then that has to be brought into the mindset of the patient or patient relatives. See, this is the reason, that's why I'm referring you to the higher center, because it requires some institutional approach as our inpatient approach or number of more doctors required for this to handle, or else we need to convey in such a sense that you will be sending to an higher center which takes care of your condition much better way. So that is the reason we are sending you, or I'm referring you to the higher center. This is the one thing. When a condition is better handled by an expert or who is experienced in that type of diseases and handling such diseases, and if you are referring the patient to such a person, then definitely you convey this the same thing to the patient that I can also give you treatment, but it will be a right thing that if I refer you to a person, one who is expert in handling these cases and your condition, definitely they will or he will going to take care in a better manner. So, and you will be in a safe hands for the further management. So that's the reason I am referring you to higher center or particular doctor. So these are the words we can use it in a very convincing manner to the patient or patient relatives before sending them or referring to the higher centers.
Thank you very much there, sir. And when the case is not like very serious, say for example a case of psoriasis, and we have like you. Let's imagine that I have a patient with a case of psoriasis, and I know that you can handle better than me. Now that WhatsApp and other things are like very common, if we share the photos or pictures of the patient to you or to a senior doctor who is the expert in psoriasis, should we be mentioning that the photos are being shared because some amount of privacy is being compromised, and the privacy issue is a larger issue in Europe and the US and in Australia and other countries?
Basically, when a patient comes to us, it itself is applied that it's an implied consent that he has come to us for the treatment purpose. Second thing comes in, if it is such issues are there, or legal concerns are there, or it may going to cause a lot of problem in the future, better take a written consent from the patient that you are going to do all these things. These are the procedures, these are the medications, and even you will be referred to higher center in a time, and your photos or pictures of your lesions will be shared with the senior doctors or experts across the globe for your betterment. For that you should not have any problem or any objections for that. If you have any objections, then we don't want to take you as our case. If it is good to you, then we can go ahead. With these words, if it is put in front of the patient and taken a written consent, then there will be no such legal issues or some problems. That's one. And sharing an information of a particular thing always in this particular WhatsApp media, through that we try to forward the information or the pictures in such a way that the patient identity is not disclosed. Only the lesions are to be focused and lesions has to be forwarded. Only in certain cases when the lesion is on the face, then obviously we can't avoid it. We have to send the photo of a person in such a way that where the person identity can be revealed. But for that, a person should not have any objection to such type of sharing by the doctors for the purpose of thing. And definitely when we are forwarding the pictures of a patient, particularly if it is from the face, still we can close down the eyes or cover the eyes with some edition or editing of the pictures, then later you can send it. But still, for example, there is something you want to convey to your senior doctor or a fellow friend or one who you are trying to refer to that patient, a particular doctor, wherein you are concerned to tell him or conveying or bring him to the notice that something inside the eye, then we cannot block the eye. We have to open it. Like in case of chronic liver disease or very strong case of hepatitis, viral hepatitis, where serum bilirubin levels are very high and icterus, yellowishness in the eye is very strongly objectionable way it is there. Then if you want to send the patient for the institutional care, for that purpose I'm sending, if you want to send the photo of that, then you cannot block the eyes. You have to keep open the eyes, and as it is you have to send, because that will be revealing the very important information to the doctor. So these are the things we need to understand while referring and sharing the information. As far as possible, if there is any legal issues are there, may you feel that there is some legal issues may come out in future, then it is better you take a written consent from the patient.
Yes, I mean, this issue came up with, I remember an incident. I was giving a guest lecture to a group of American Ayurveda practitioners, and a couple of them were MBBS doctors practicing there. They were also like interested in Ayurveda, so they're practicing. So all other people, when they were interacting with me, they were having their camera on and asking questions and whatnot. But these two doctors who were like MBBS fellows, they were not keeping the camera on. So the organizer asked, "Can you please put the camera on?" So they said that they were from New York. I mean, they were in their clinic while listening to this session. So they said that if the camera is on and suppose a patient enters in and patients say hand or some part of patient gets recorded in the camera, it can become a big legal issue. So, I mean, this is just a information sake. There is a European rule in regarding websites that if the websites are tracking information regarding anything like the visitors location and all, they have to take exclusive content. That's why we see sometimes this website has cookies and all. So more and more the world is becoming open and connected. More and more stringent the privacy rules are also becoming.
See, the part of the privacy rules that they speak about the privacy and all these things, and they will reveal everything to the one who is providing the social media platform. He will be giving everything. Aadhaar number, even your phone number, your address, your location, your GPS location, everything will be there with tracking. So they will be knowing everything. It's only for the concern. If anybody is having such type of issues that he don't want to be get noticed or even recorded, or his one should be not forwarded, then such a patient that you need to better understand them with clarity, and you explain them why you are not supposed to allow this, and you explain them what is the importance of this. If person, even many times we come across this type of issues when young students have been teaching on these lines. When the students come to the hospital, particularly in the paid hospitals and where the private patients are there, they are the regular students are not allowed, internship students are not allowed to enter in and do the examination and to learn these things. Many times they complain that. Of course, there is a issue with that because they are private patients, but if they are not paid and if they are regular students, they should be allowing the young doctors to learn. If that is the study material they are providing to the young doctors, then only the young doctors become very good in that their identification and diagnosis and treatment modalities and all these things. They'll learn it and they'll become a good doctor and they'll serve the society. They should be given the right chance to understand them. So if anybody has an issue related with privacy and all those things, it can be taken as per the lines of locally available rules and regulations. We can follow it, but still we can still go for a written consent. That will be comparatively better. If you take a written consent from the patient that you may share this information with this, of course, without disclosing the name and details of the patient. It's only technical details will be shared.
So as Pradeepaji has written in the chat, patient's identified information is highly confidential. But like Guruja sir told, just sharing the patch of the psoriasis, so all those things, not in social media, but to a specified person, that should not be a problem. Pradeepaji can correct there. So another aspect of patient referral is the reverse. When we get patient referral from other people, how should we handle that? So first point I would imagine is common sense is to have kind of a gratitude for the doctor who has referred and not to talk inferiorly about that referring doctor in front of the patient. So that is kind of a common sense. And what are the things to consider when the patient is referred? I mean, should we write him the letter once after we see the patient to inform what has happened, and should how the follow up should be maintained, and etc. Sir.
If a patient has been referred to us in a systematic manner just through a letter or something like that along with the patient, then it is literally a courtesy of the treating physician. Once he has diagnosed and he has taken care of the case and he has made a detailed notes of it, it is expected out of him that he should convey that the person, the doctor one who has referred to us, he should be conveyed and he should be informed about the condition of the patient, what is the diagnosis and what are the investigations done, what is the treatment protocol has been initiated, and thanks for the referring the patient in the right direction in the right time and all these things, and convey him that please do in touch with that, and if any information is, feel free to ask. We will be sharing the patient related details to you. So that type of communication back to the person who has referred is always expected out of a thing. But many times we can straight away in a very close contact, if somebody sends with a letter, then we will send a WhatsApp chat. Thanks for the referral. This patient is being handled in a systematic manner and this is the condition and we are treated with on these lines. So that will, and he is doing good. So such type of information will be usually passed on to the person one who has referred back. Definitely such type of referrals, if it is there, then formal referrals. For that you need to at least have some thanking letter or some thanking note or something like that, what is happening actually exactly, that has to be conveyed to the person who has referred.
Yeah, I mean, writing letter and letting the other person know that it has been kind of that care has been taken for the patient. That is so very important. Thanks for the point there, sir. I know that you get a lot of referrals personally to your clinic, your center, and it is probably a dream of many Ayurveda practitioners to get a lot of referrals, and to not only so that they know that they have value in their fellow community of Ayurveda doctors and allopathic total medical community. So what is the secrets, sir? I mean, you also get referrals from even allopathic doctors also. I know that personally. So what is the secret?
For that, your hair should become gray first. So it should take certain time. So once you are in the field and you are giving out the result and continuously you are giving out success stories, and you have taught to the students, and you have given information how the things are and how the patient when he came and what are things you have done and how the outcome is, that if you are disclosing those things through your website or through your close friend circle or WhatsApp groups or even Facebook Live or Facebook groups or something like that, definitely it will going to help to increase your referral things. When it comes to the skills of doing like some surgeries or some type of excisions and all those things, or some cosmetic things like that, in case of a person one who has done Shalya MD or MS. So such type of things, usually you need to, you don't need to have gray hair. You need to have just a skill. A young chap can also be a very superior or good quality surgeon. Then he can do all sort of dhanvantri karma, whatever the things. Tatra vidya dhanvantriya kriya vido, that can be done by a person one who has definitely has the skills of how to handle the things in a surgical manner. So we need to understand these two things. First thing is, to all these things, what it is require is basically our theory as well as practical related information to the entire subject should be made strong, and that the information of theory and practicality, it must be made strong only by repeated readings. Then Tadvidya Sambhasha, continued medical education, repeated readings, consulting the books and consulting the seniors, getting the information, rebrushing our knowledge repeatedly, how old you may be, but once again reading the book repeatedly now and then, rebrushing yourself is a very, very important task that has to be done. Particularly for a doctor or a Vaidya, he should be having information very much updated to the date. So it should be made Kalanurupi, Yuganurupi.
Yes, sir. And yeah, I mean, for the surgeon, we would prefer not to have too many gray hairs, otherwise the hands would be shaking. And regarding the reading, I also noticed that just ahead of this session being started, you also like referring and reading, and I mean, you are kind of a live example for that. And also, when I am kind of in my personally speaking, when I am reading some new book or some new things, or participating and watching other senior people's experiences in WhatsApp and whatnot, I feel a lot better and sharp on those days rather than the other days in which I personally am reading. So, Satata Dhyayana and continuous reading is so much very important virtue for any Ayurveda doctor. So, moving on, there was some questions asked previously and in the last class which we were not able to address. Coming to the question regarding the Brahmi, there was this question that isn't Brahmi being cold or Shita Virya a little drying? And what is the best Anupana or codering for Brahmi when we are giving it to someone who has severe Vata related disorders, dry skin, dry stools, or maybe memory loss, again, Vata related disorder? Your thoughts on that?
No, we need to understand certain things. There are peculiar way a drug behaves in the body. Brahmi is having multiple roles, but still, out of those important functions, there are very much sharp and very much pronounced functions will be there for certain things. Not everything will be addressed by a thing. If see, for example, whenever we read, most of the drugs we say it is Agnivardhaka, it is Deepana, Pachana. But we don't use all those drugs for the purpose of Deepana Pachana. Whenever we want to have a Deepana Pachana, we typically select Chitraka. We typically select Trikatu. There are drugs which are Jiraka, which is very specific for the Deepana Pachana. That purpose only we will select. Similarly, whenever there is a Vata Vardhana is there and we need to reduce the Vata, then we need to understand first basically where these things are there. Whether it is at the level of skin, or whether it is at the level of Pranavashrotas, or whether it is at the level of Mahashrotas. So that has to be taken care, where exactly things are there and which Vata, which site is very, very important. If you understand this what is the site, where it is happening, then accordingly. For say in this case of Brahmi, so Brahmi, you want to give it in a patient of a Vataja condition and where there is a memory loss and all those things, being Shita and all these things, how can we go for it? It's the best combination for Brahmi. It has to be given, then it is better give it in the form of Gritha. Brahmi Grita is the best format because Brahmi Grita has the special capacity to pass through the blood-brain barrier. So that is the reason we use it Brahmi Grita. That's a very good one. And when we want to have a Rasayana effect, better it is in the form of Swarasa. So very clearly, Acharyas have very clearly mentioned in what way it should be used. Manduka Parani should be in the Swarasa format. Shankapushpi is in the Kalka format. Estimadu is in Churna. Guduchi is in Churna. So all these things very clearly the Acharyas have explained for what purpose, what should be used and how it should be used. So if you want to use your information or to customize the procedures or a protocol to a patient and according to the needs of the patient, then of course think on those lines of Samanya Vihi Siddhanta. What are the lakshanas of the patient? And you anticipate that lakshana is produced due to which dosha, and then at the level Vektasthana, you identify it, then accordingly where what should be used. If it is a dryness in the skin, then why you want to go for a Brahmi? You can straight away go for some Grita application, Shatadota Grita onto the skin, or Karanji Taila applied, or coconut oil applied onto the skin. So like that, where exactly the things are happening, accordingly we need to go for thing. Wherever it is a locally manageable, then you apply it, do it locally. There are one who is lean, thin and is ruksha and even body mass is lost and everything. Then such a person requires a Vatahara Dravya or a Kapha Dravya from the core inside. So then we need to go for some Agni Vardhana, Deepana Pachana Dravyas. Along with that, then Brahmana Karma should be done, initiated from the internally. Not by simply applying oil from outside won't do any good thing here. So we need to do that. And sometimes even if the skin is also ruksha, along with that is lean and thin, then you can go for both internally as well as externally snehana. So internally also we can go for this snehana with Gritapana and all those things. Then externally also we can go for Abhyanga with Taila and all those things. So like this you need to plan according to the requirement. Each and every patient will be a different set of combination, will be a different type of doshic imbalance, then accordingly we need to address it. So it is very typically based on the requirement, whatever the requirement, whether it is at the level of skin, Vektasthana is in the skin, then accordingly do it at the level of skin locally. If it is internally, any tissues involved, entire whole body mass is less, is a weak, lean and thin, then go for the Brahmana Karma inside and reduce the Vata. So that's the reason we need to understand.
Yes, and going by the question, we should not fixate on the herb and then think about the disease. We should be thinking about the disease first and then go for the herbs based on the site of pathology, like what you have said, sir.
See, very clearly Ayurveda says, Rogamadam Parikshetam Tadanantaram Aushadam. First, Roga has to be identified. Then, what drug should be given or what protocol should be fixed for this, that has to be concept. Then, concept after that, exactly for this particular case, XYZ, what should be done? That has to be done. So, we need to understand that very clearly. First, identify the disease, diagnose it. You may be having very close diagnosis, maybe probable diagnosis or provincial diagnosis. Okay, no issues. You do it that one. Then go for the Sadhya Sadhyata assessment. Then you try to give a medicine. Then once the medicine you start using it, then protocol, whatever the thing, whether Shodhana is required or whether even Shamana is itself is enough, all these things you can straight away understand the things and you can use the protocols as per the requirement. But beginning with identification of disease. Rogamado Parikshetam Tadanantaram Aushadam. So Aushadha comes in the last.
Yeah, I mean, the brilliant, right point, right shloka. Thank you so much, sir. And coming to the herb of the week, I mean, let's concentrate on Gokshura, very important herb, one among the Dashamulas. Can you please take us through the Gokshura, sir?
Gokshura is one of the important herb. Of course, very commonly we can see as a weed roadside, as a prostate, a spreading herb on the ground with yellow color flowers. And when the fruiting is there and as the fruit will be having spines. That's a very common, and that is called as Kshudra Gokshura, it's also called as, and one among the Dashamulas. And technically or botanically, it is known as the Tribulus terrestris. So here, many a times we know that we use the Tribulus terrestris or Gokshura whole plant. While using Dashamula also, many a times whole plant is used. Sometimes only for the purpose of making kashaya, then the root is used. Otherwise, even the fruit is taken. Sometimes even entire plant is taken. But under the Dashamula, entire plant along with the fruit and root, everything is considered, because this is being in a very small and herb type of material. So it's no problem, no issues with this. And this is a very commonest in the dry areas of across India. It is easily available. But we have two varieties here. One is called as Bruhat Gokshura and another one is Kshudra Gokshura. Bruhat Gokshura is a different family member, and it is a Pedaliaceae member, which is Pedalium murex. It is an erect plant, whereas Kshudra Gokshura is from Zygophyllaceae and it is spreads on the ground. So it's horizontally spreads on the ground. But both are having typically spines on their fruits, and they're extensively used for the purpose of urinary tract issues, particularly this Gokshura. The name itself has come as a Gokshura, means it is usually previously it used to stuck to the hooves of the, or in between the hooves of the cows. That's the reason it is called as Gokshura. And this is having also called as a Swadhamstra, because it is having projection of spines, and it is also called as a Swadu Kantaka. That the reason is because it's a Madhurasa and Madhurvipaka. Because of that, it is called as a Swadu Kantaka. Trikantaka is there, mean 3 to 4 pairs of spines are there in that fruit, hence it is called as Trikantaka. Like that, there are many names have been given to this, and extensively this drug is used for the purpose of Ashmari, particularly renal calculus, urinary tract infection, Mutra Krichrata, and Mutraghata, and such chronic renal failure, and such type of genitourinary tract infections or genitourinary tract problems, or it may be bladder issues or irritable bladder, or whatever it may be. All these things, in those conditions, it is usually used. And this Gokshura is also one of the important drug which enhances the activity of kidney, thereby eliminate the waste or the water content from the body through urine. It enhances the filtration mechanism at the level of kidney. So that is the reason many times we use it even in case of anasarca or even the shotha or pedal edema or something like that, and even that Gokshura is used. Probably because of this reason, even in the cases of in pregnancy, in the third trimester of pregnancy, there will be a little bit of edema, pedal edema many a times. People usually use this in the form of a Ksheerapaka. Gokshura Ksheerapaka is also recommended there in order to avoid that eclampsia and pre-eclampsia conditions, and as well as the third trimester pregnancy related pedal edema and such type of things. Are generally also in any case of Shotha and chronic renal failure and those conditions, Gokshura is one of the drug of choice. And as well as Gokshura is very wonderfully used, and it gives a result in case of renal calculus. It is a very good one because of its crystal contents. It breaks open the calcium oxalates and all those things, and thereby it expels the kidney stones or breaks open the kidney stones, and it doesn't allow the formation of kidney stones. So that's the reason most of the renal calculus condition we use Gokshura in the form of either Gokshura the Guggulu or Gokshura the Churna, Gokshura the Kada, or even Ashmari Harakada or Mutra Lakvata, something like that. So all these things are very commonly used preparations in case of and of course Gokshura being one among the Dashamula Dravya, and wherever Dashamula is used in all those conditions, it is going to help. And Gokshura is having Guru Snigdha Guna, and Madhura Rasa, Madhura Vipaka, and it is one of the Samana Pratyarabdha Dravya, and definitely it is going to act as a Balya. Even Pushtida, it has been explained in the shloka very clearly. It increases the body bulk. For that purpose also it has been used. Even though it reduces and removes excess stored accumulated water from the body, but it helps to increase the bulk of the body bulk, maybe by promoting the protein metabolism to some extent. But exactly how it functions in that direction on the grounds of the modern mechanisms, it has been not observed or explained. But our acharyas have said it is Pushtida, definitely based on the Sarvada Sarvabhavanam Samanam Vriddhi Karanam. Based on that point, it is said very clearly Pushtida. Pushtida means it is going to improve the strength or balya in nature, promotes the bodily strength. So this is one of the important plant, and of course a very commonly available plant, and with extensive activity and pharmacological activity is present in this plant. And that is a bright yellow flower, which is a striking feature in identification of this plant.
Yes, sir. And it's useful in kidney stones. Can we use this also, or does it have any action on the gallbladder stones as well?
As such, for the purpose of gallbladder stone, it won't be useful directly, but by you concept wise, we can try it, but may not be sufficient, because this particular Gokshura has a special action on renal parameters and renal functions. So I don't think so. It is going to help in any way to the cholelithiasis condition.
And regarding it's also a mutrala, meaning it improves the urine output,
Good.
and it has a flushing action. Is the flushing action the reason behind its kidney stone breaking effect, or it has standard lithotriptic kidney breaking effect on its own?
It has both the actions. It has a braking effect as well as a flushing effect. Both the things are being done by this. It not only improves the filtration, urine filtration, it also even helps in removal of the crystallization, and it also helps in the destabilization of the stones, and even the cracking of the or cracking opening of the stones for many things. So it is not simply just because of flushing effect. It is not only flushing effect. If you want to have a flushing effect, even water can flush it. You can plentifully you can drink water, but it is not so. That's what usually the people will be guided by the other side of the Western practitioners, that you drink plenty of water. Just by simply drinking water may not flush the things. There are certain requirement is there, and this is one of the important drug which has a special effect of breaking and as well as flushing the renal stones or the kidney calculus or renal calculus.
Because it can increase the urine output, and a standard diabetic patient will be also having polyuria issue. Should we be careful while using it in, say, diabetes?
See, it's not a question of using it in diabetes or something like that. See, our intention is not for the diabetic. Our intention is for the kidney function improvement. If a person is able to expel the sufficient quantity urine or not, in such a mutra krichrata, urinary tract infection, and all those conditions, we use it. Our intention is not to increase the urine output in a patient who is already suffering from diabetes. So that is not an intended case here. So when we are selecting a patient, of course, if a patient is there, he is a diabetic, even with the diabetes, he is also have kidney stone. Then you can use it, no issues. You can use the drug Gokshura even in that condition. This will help in flushing out as well as removing the kidney stones.
And regarding the Pushtita action, I have a theory in my mind. Please correct me if I'm wrong. That in Ayurveda, excess amount of fluid or water part in the body is considered as Kleda, which is not so very good. That's why repeated drinking water only, even if the person is not thirsty, is not recommended as per Ayurveda. So because it relieves out the excessive water content, system is better maintained, the dhatus are better well formed, and excessive accumulation of kleda in the body is avoided. That's why probably it acts as pushtida.
See, whenever you just to use excessive Kleda is there in the body, definitely it is going to cause a problem. It not only Kleda, anything in excess is always injurious to the body. Body has certain things and it has its own proportions and limitations. One has to be in that limitations and proportions. If Kleda inside the increases, then automatically all the Kleda will come to the basti once again, and that ultimately results into Prameha. So that Kleda has to be moistness and moisture and something like that. It has to be maintained as per one's required. See, when a person, one who is working in the field outside in the sun, will have a more perspiration, then he requires a lot of water and he will be drinking more and more water. But if when he is drinking more and more water also, but in the same way he is also removing the water from the body. So for him, doesn't this make any problem? Otherwise, if you are taking too much of water repeatedly in order to avoid the crystal formation and all those things, and you are sitting in AC, you are not doing any physical exertion, then that will retain in the body and that kleda becomes a problematic thing that has to be avoided. So we need to understand exactly where to do, what to do, and what not to do. So very clearly, Kleda simply doesn't cause any problem. If it is reaches beyond a limit, definitely it is going to cause a problem.
Because it is one among the Dashamulas, the group of 10 roots. So do you have any preference like when to pick Dashamula versus Gokshura, or can it be replaced or substituted? Dashamula versus Gokshura.
No, it is not a right type of combinations that we cannot simply, in place of where we are supposed to use Dashamula, I can use only Gokshura. That is not right. Dashamula has its own role. Dashamula is Tridoshamaka. The drugs present in the Dashamula is Tridoshamaka, whereas Gokshura is simply a Vatashamaka and Kaphavardhaka, to some extent Pittashamaka. So it cannot be replacing the Gokshura, cannot replace the Dashamula.
Charuji asks, does this help in adrenal fatigue?
No, we need to understand adrenal fatigue means then what exactly the things happening and what are the lakshanas present in the patient. Many a times it so happens just because of some branded diagnosis, we cannot simply go with some drug using there. We need to understand what are the lakshana, what is the problem, the presenting complaint of the patient. It may be a fatigue or what it is. It simply won't, and if it is these type of bigger, yapya type of diseases or asadhya type of diseases, just don't think that which can be handled by using one single herb or something like that. No, that cannot be. That is not possible. We need to understand that what exactly the things are happening and what is the presenting complaint of the patient. Based on that, whether we can use it or not, we can decide it.
Yes, and adrenal fatigue is not a kind of a standard disease. It is just naturopaths use this term. Better analyze the underlying cause, shrama, klama, what the patient has, and which particular organ in the body. Better to analyze the disease only than come to an Ayurveda diagnosis just rather than just vague. Point well taken, sir. And next question, Pradeepaji asks, for ideal Bhedana property, is Gokshura Guggulu is a better choice over Gokshura Ksheerapaka? How to select ideal form of a herb? Does it depend on both the Roga and Rogi?
See, it's very clear. We don't use the term simply as it is Bedana. Whenever we use the term Bedana simply without any prefix or anything, then we think that it is a Mala Bedana. So it is not the Ashmari Bedana. If you want to be specifically Ashmari Bedana, then you have to say that Ashmari Bedana. Otherwise, if simply Bedana means it is for the Mala Bedana purpose, and Katuki is the best drug for that Mala Bedana purpose. So when for the purpose of renal calculus or Ashmari Bhedana, if you are asking about, which is the best one, you can use the herb Gokshura in whatever the better way it is available to you. If it is Gokshura the Kada, okay. If Gokshura Adi is not available, only Gokshura is available, okay, you can prepare it and do it. But in this case, when there is a crystallization and calcium oxalate are the things which are helping to form into stones or the kidney calculus, it is better we should avoid Ksheerapaka here. Ksheerapaka should not be right kind of combination or a drug. Here it is better Kashaya should be given. Or even Guggulu is also no problem. Gokshura the Guggulu or Ashmari Harakada or Mutra Lakwata or even Gokshura the Kwata, something like that can be given instead of that. Only we go for Gokshura the Ksheerapaka or Gokshura Ksheerapaka, particularly in case of third trimester pregnancy. So that can be done or used as per the need. That is only for the purpose of removal of the shotha and during that time, and it should be nourishing. So that's the reason that's why Ksheerapaka is given. But Gokshura Ksheerapaka, as it contains milk in it, and which is not a good combination in case of a calcium oxalate crystallization, which is taking place of Ashmaris, and we usually don't recommend them with any kshira or even all the preparations of the milk and milk products will be avoided to those patients of renal calculus.
Thank you very much, sir. Be very specific with Dravagana terms when you are talking to Dravagana professor. Point noted there. Hypertension, and wherever there is a body fluid retention, as in case of cardiomyopathy, where fluid restriction is required and where the body needs to lose fluid, and anasarca, like you told. So wherever the body fluid retention is there, probably we can think of Gokshura as the go-to herb.
Definitely. Gokshura, Punarnava, and these type of drugs will definitely help to remove them. All even Trinapanchamulas, Kushakash and Nalagarbha Kondekshu, and these type of things. And Punarnava, definitely, and Gokshura, even so to some extent Kushmanda, all they help in supporting removal of the excessive accumulated water content from the different part of the tissues of the body. So, and they help to improve the urine output, and definitely they improve the kidney functions.
Yeah, Charji asks, probably we can spend a Gurubodha session exclusively for adrenal fatigue, but just to answer this question in brief, can you please explain adrenal fatigue through Ayurveda lens? When the adrenal glands function below the necessary levels, fatigue, particularly upon waking, and intermittent crashes throughout the day happen, and poor stress response and mood regulation, cognitive issues, or brain fog. Though it looks like adrenal issue, it could also be, say, a depression. A standard case of depression would be having the same symptoms. A standard case of other organs not working fine in a chronic liver patient or chronic tuberculosis might also have these problems. Can you please put your input, sir?
So it may be even an endocrine dysfunction, and there may be multiple endocrine dysfunctions. There may be multiple endocrines involved. It may be even pancreas is not functioning properly, even ovaries are not functioning properly. So there are many issues associated with. We need to assess. Adrenal glands are not functioning means we need to assess them through the blood workup, whether the adrenaline gland production is in excess or not, all these things. Once we just to identify this in this pattern, then only we can go for that branding, whether it is adrenaline fatigue or something like that. But usually technical term is not adrenaline fatigue, we don't use it. Adrenal gland dysfunction is the one which we use it usually, or the hyperadrenaline conditions, or even the one. But it is not major condition which will not be used by simple single drugs. It is not possible, because it is all endocrine related things they require, and they are the seat of Agni. Various type of hormones are produced, and then whenever we need to give a medicine which is very sharp, penetrating, sukshma in nature, and it should be multi-drug. Usually it cannot be a single drug, we cannot run into that, or it should be a tikshna dravya if it is a single drug. So by simple drugs we cannot approach these type of diseases, and we cannot expect a result out of that. And of course multiple issues will be there in the type of endocrine dysfunctions. Then we need to address them, all of them, step by step.
So I had received a question on that, why Gokshura is used as Krimighna. Acharya Charaka mentioned Gokshura as one among the Krimighna Mahakashayas, but Rasapanchaka of Gokshura is clearly opposite to a classical Krimighna. For example, it should be Katu, Kashayarasa, Katu Vipaka, Ushnavirya, but Gokshura is Madhura Rasa, it has Snigdha, unctuous quality, Madhura Vipaka, Shita Virya, cold potency. which can increase the Kleda in the body, which is Kleda is a good platform for Krimis to happen. So what could be the logic there, sir?
See, first of all, we need to understand Krimighna karma. First of all, this Krimighna karma explanation in whatever it is given in Ayurveda itself, it is very clearly said it is a Prabhavajanya karma. This is not a Viryajanya karma. When Vidanga, one of the important Krimighna dravya, it has been subjected for various studies or in vitro and in vivo studies. On the outside the body, when Vidanga has been poured onto the krimis, they didn't die. But same Vidanga, if it is given to a patient, one who is having helminths inside the body, it shows in a very good anti-helminthic property. So it has something which is an atmosphere present inside where a drug can act, and there may be some byproducts produced at the combination of certain secretions in the body along with the drug. So there are issues in like that. So simply we can't, just because of Rasaguna Viryupaka only, if it is producing, then our Acharyas would have said the same thing. This is the Rasaguna Viryupaka of a Krimighna Dravya. No such things have been explained. Krimighna, Vishagna, Hrudya, all these karmas are Prabhavajanya, and Prabhavajanya karmas are not possible to explain on the lines of Rasaguna Viryupaka. So we need to understand this. So we should not have such idea in our mind that ideal Krimighna Dravya should be Katu Vipaka, Katu Rasa and something like that. No, that is not a criteria. It may be any drug which is having capability of, it is called a Swabhava of the Dravya, it's called the Prabhava of the Dravya. It itself has a capacity to kill the insects or even the worm infestations or even the helminths, whatever it is. So it is called Krimighna. Here the drug Krimighna, why, what may be the reason Acharyas have used it? Because it may be Krimi in Ayurveda, it is present or accepted at multiple levels. There is a Amashegata Krimi, there is a Purishya Krimi, there is a Krimi at the level of Rakta. So there are plenty of type of Krimis have been explained. We don't know exactly for which Krimi Acharya is talking about. So Krimighna means here the drug is capable of killing some Krimis. Krimi may be a microorganism. So definitely Gokshura is one such drug which can even clear the Krimis from the urinary tract. So based on that, if it is any urinary tract infections are there, we use a lot of Gokshura. So definitely it gives a result. So then in that sense we can accept it as a Krimighna. It doesn't mean that it should be one which is having a particular type of Rasaguna Uryapaka, but Krimighna karma itself is a Prabhavajanya karma. It cannot be attributed to a particular type of Rasaguna Uryapaka.
So how does Ayurveda address lower amount of blood, urea and nitrogen?
How to address means if it is ideal one level, then no issues. If it is excess, then accordingly we treat it as it's a mala. It has to be thrown out of the body and it is increased in the body and it is staying there. And then definitely we need to improve the kidney output or the urinary output. Then definitely these type of drugs will help in removing the urea and creatinine from the body. So, and this is basically mala which is produced inside the body. It has to be eliminated, and that is usually which is being regularly done by the urine. Mutrantu Kleda Vahana, it is said, it is Kleda has been removed from the body through the Mutra. If it is definitely it's in excess and it will be removed through the urine. And if it is creatinine and urea and these things are there, definitely the kidney functions will be improved by these drugs and definitely we can use it. For example, in a patient of CKD, chronic kidney disease, patient has crossed the third stage, fourth stage or even the final stage. Then there is why we are using a lot of Gokshura and all those things, Punarnava, but still we are not getting the result. Because where these tissues, drug which is supposed to go and act, the tissues itself is damaged already. So there is no sufficient target tissues to be acted upon. Definitely, so there will be no results. That is the reason many times we don't find a result in CKD to some level or anticipated level. Otherwise, in generally, in any Shota or any type of thing, and general first time detected cases, definitely we will find a good result by using Gokshura.
Thank you there, sir. Anjanaji asks, wanted to ask about constipation. I have seen that some people do not get relief even though they are taking Triphala, Avyarista, etc. So, what are the reasons that people have Krura Kusta symptoms even though they change their ahara, etc.?
It requires a certain time. We can't expect that till yesterday I was supposed to eat something and today I changed it and now I am changing it, and why not getting the results? It takes certain time. First thing is analyze the prakriti of the person. Then comes the kosta. You decide what type of kosta is that, whether it is a krura kosta, mrudu kosta, madhyama kosta. If a person is suffering from krura kosta, in a Vataja type of person or Vata Pittaja type of person, then whatever the lakshanas of constipation or Vibandha has developed, definitely it will be of more stronger and pronounced. So in that condition, you may require the good quantity or more quantity of medicine to get the result. Then try to analyze whether there is a severe rukshata, then improve the rukshata by giving snigdhata. So you give snigdha, just simply giving by Triphala Churna, you cannot give a relief. Then you need to go for increasing the snigdhata in the kosta. To improve the snigdhata in the kosta, you need to go for Yasti Madhu, or you need to go for Draksha, dry grapes to be given. Like 10 dry grapes are being put into water, allowed to soak down for entire night. In the morning, first after brushing the teeth and all those things, you consume these 10 swollen munakka, what you call it, dry grapes. So if it is regularly make a practice, then slowly the gut atmosphere changes. You need to wait till these changes takes place. Then still if you are unable to get it, then you can go for a stronger Tikshna Virechana Dravyas are there which can stimulate and irritate the colon. It may be Kshudrantara or Bradantra, it is going to irritate them, and then thereby excessive water is being secreted and make the stools to open up. So that is the reason we need to understand what drug should be taken for whom. See, we have our disposal Aragvada, we have at our disposal Jayapala, we have at our disposal Triphala, Haritaki. Some people with simple Haritaki, they'll get very good bowel movements and very good bowel evacuation. Some people with Triphala, they'll find very good. Maybe for initially few days, there'll be good results. Later, once again, they complain of constipation. Then there is other aspects need to be understood. The patient may not be much ambulatory, he will not be moving, he will be having a sedentary lifestyle, and he is consuming very less fibers in the diet, and he is not consuming sufficient oilness present in that snigdhata in the ahara. So all those components of food has to be taken care of, and even the vyayama part of it should be taken care of. Then comes the role of medicine. So then accordingly we can select. We can even select the Markandika Patra as Swarna Patri. That also helps in evacuation, which contains anthraquinone derivatives. And of course, to some extent, even Kumari also helps it. So there are plenty of drugs at our disposal which can be taken. So from Sukhavirechika Dravya or Mruduvirechika or laxative drug to that too, we may even go to Tikshna Virechika, like even Trivrit Kleha, even for the, we can go for Jayapala, we can even go for the Danti. There are drugs of our disposal which can be used for many modalities and even the dosage forms. So no need to worry about sticking only to Triphala and Haritaki. There are plenty of drugs to use, but you need to understand that when to use it, where to use it, in what dose. That is the one required information that we need to know.
Sticking on with the Nitya Virechana with Avipattikara and Aragvada, can that be continued for 45 days?
See, whenever we use any drug for any condition, how long we need to use? It's a very clear idea that our anticipated results should be achieved. Till then, it should be used. Why you want to fix yourself to 45 days, 60 days, 30 days? No need of such fixing the days are required. We need to understand that whether till anticipated results are obtained. It may achieve in 7 days, you may achieve it in 10 days, or it may even for 30 days, as many number of days required to maintain or to come to a conclusion or even get a result. Till then, you use them. So don't make it a hard and fast rule that it should be used for 45 days. There is no such criteria as laid down in classical text. Use till the results are achieved. convincing results are achieved, till then you need to use it.
But still, one and a half teaspoon of ayurvedic churna is also fine for, like, for example, hypothetically 45 days.
No, it doesn't make any sense. I cannot say it should be considered in such sense. Each and every patient is a new one and is a new combination. His body weight, everything has to be assessed accordingly. You need to fix the dosage. Simply, I can't say 1.5 spoon for everybody. No, it is not possible. It is not a right kind of thing. You need to understand that what is the body weight of the patient, what is the agni of the patient, what is the complaint of the patient and nature of the patient, everything, and even the season. You need to consider a lot of things. Anala, Prakriti, Desha, Vaya, Kala, Satmya, Ahara, everything has to be checked up, and then accordingly you select which is the best suited for that condition.
Thank you, sir. Gokshura Uttarabasti versus oral intake of Gokshura in case of UTI. Can it be given as Uttarabasti, sir?
I don't think so. That is not a right kind of thing which is can be given, because Uttarabasti giving itself is a tiresome and it's not an easy job. And when condition is already there is an UTI, urinary tract infection, and you want to go with that infection, something like that, pouring from the outside, that should not be. We want that infection should go out of our system, that should be flushed out. So in that condition, it is better to flush out something from inside. It should be pushed out. We should not pushing it from something from outside. It's not a right kind of thing. We have a better drug. I mean, this Gokshura can be used in the form of Ashmari or Akada or even Gokshura Kada or these things internally. Then definitely the things will improve, and patient will be definitely pouring more and more improved kidney function, and they'll be passing urine, and that more quantity of liquid and urine that will be flushing out the system, and thereby removing the load of the bacteria from the system. So that is a better way of doing it.
Thank you, sir. Last question. Victoria ji, can you please ask your question?
Yes, Vaidaji, I wanted to understand the principle of the treatment. If the person is Vata Kapha Prakriti and has mainly Ama and Kapha conditions like Mandagni and hypothyroid and overweight and fatty liver, but at the same time the thyroid issues is Hashimoto's autoimmune disease. So which treatment plan you would choose? Do you go more for the balancing Kapha and Ama, reducing, or more to the Pitta balance because it's inflammatory condition? Is it like more into the Ksheerapaka and Trikatu direction or more Kanchara Guggulu? Which direction would you take?
Definitely, when there is a multiple diseases are there at our disposal in a single patient, it is, of course, it's a syndrome condition, or it may be a Vyadhi Sankara, we call it in Ayurveda. It has to be checked by step, which is an alarming one and which is going to cause a trouble to the patient. That has to be enlisted one side. Then, which is an important condition that we need to break it first. So that is to be analyzed. Accordingly, then we can go for it. Here, Hashimoto is also there, Agni conditions, Ama is also there, and all these things, thyroid issues are there. So when such a patient is there, and it is a very difficult to handle when the internal organs are also not supporting, even some little bit of change in the food diet, the patient may have some what we call loose bowels and all those things. So in that condition, first you go with Agni Vardhana Dravyas, all those which supports our liver functions, and Agni Vardhana, Pachaka Pitta improvement conditions. Then along with that, go for Kanchanara Guggulu type of material. Then still add on the third day or fourth day or fifth day, whenever a patient gets sufficient Agni, you can add on to Gomutra Haritaki or something like that, which is a drug which is specific to the disease. So first you can analyze the Amshamsha Kalpana, we call it is in Ayurveda. Break down the things into different components, analyze which doshas involved, then which is to be handled first. Accordingly, we can go for it. For example, in this case, we need to increase the Agni first. So we need to increase the Agni first. For that, a little quantity of Trikatu or even simple Shunti or Jiraka for a few days initially. Then once that is improved, then you can go for Kanchanara Guggulu and type of things for another few days. then add on Gomutra Haritaki. So like this, you step by step increase the drug, and once there is a proper Agni, because once Agni is there, then only even the medicine which you are giving, that also be digested and assimilated, and it helps it to show the results. So there is no hard and fast rule that we need to handle only these type of cases in this condition only. Like, there is no hard and fast rule. A presenting complaint of a patient is very, very important, which is annoying to the patient. For example, in patient with a severe pain, then pain is annoying things. In case of a skin condition, itching is the first annoying condition. He wants to get rid of the itching. So like that, there are a lot of issues will be there. Whatever the things which is suitable, accordingly we need to plan. But we need to keep in mind important aspects. Vata is a very, very important component or dosha inside the body. That's why Acharyas have very clearly given instructions in many of the conditions. Adavante madhyecha marutam parirakshitaha, they are said. If it is in the beginning or in the end or whatever it is, try to maintain the vata. Vata should not be disturbed, because vata is the one which is carrying. We said that very clearly. Pitta pangu kaho pangu pangavo maladatava vayuna metra niyanti tatra gachanti megavat. One which is capable of carrying anything inside the body to different part of the body is vata. So we need to maintain the vata inside the body in a very normal way. That is the one thing. Then comes the Agni. We need to retain the Agni, because very clearly Acharyas have very clearly stated that Roga Sarvepi Manda Agno. So every disease is due to Manda Agni. Agni has to be maintained. So we need to concentrate on the improving of the Agni. Once this Agni is improved by using Chitrakar, Trikatu, Jirakar, Shunti or something like that, then the basic drug in particularly for the disease, Vyadhi Pratanika Dravyas, like Kanchanara Guggulu, then followed by a few days later, once this is stabilized, you can go for even Hamsapatyadi Kada, you can even go for Gomutra Haritaki, like that. So accordingly, step by step, improve it. And of course, observation and get a feedback. Every time when you are doing it, just only simply do it from your side. No, you will also get back an information from the patient side. You are treated with particular conditions and drugs, and the result is that he is feeling good, his improvement is there. Such things will get a feedback. Accordingly, you can modify and alter the combinations, as well as in the drug management protocol can be designed accordingly.
Thank you, Vaidyaji. This was just a fabulous, excellent reply, and I'm very grateful, because I was confused. Whatever I can give any hot spices, will that increase the inflammation? That if I give Trikatu, will then inflammation increase and then the thyroid disease increase? But I should say, first is Agni, focus on that, and that will help the whole condition.
Definitely.
Thank you.
Thank you for the participants for the questions. So thank you very much. What are the questions that were left, we will take in the next class. Thank you, Guru Raja sir. Thank you so much.
Thank you. Thank you.